The Kenya Medical Association is in full support of a further reopening or further opening of the economy at the national presidential address this week. Now, this comes as Kenya recorded 244 new COVID-19 infections out of a sample size of 3,707 within the last 24 hours. This now brings the total national count to 38,115. Today, 40 people recovered, bringing the total number of recoveries to 24,621. Unfortunately, on a sad note, 2 people have died, raising the death toll to 691. Helen Aura reports on the key concerns ahead of the next presidential address.
Could there be a full reopening of the economy? The Kenya Medical Association supports such a move in phases.
We recommend that the curfew be lifted, but some measures like for social distancing, wearing of masks and hand hygiene should continue. We should not say we lift the curfew and open restaurants and clubs for people to continue interacting. We are saying let's do a first reopening as we continue preparing ourselves to better respond just in case we are hit by a second wave.
On the other hand, the association has pointed a finger at the state's testing capacity with lack of sufficient reagents.
We like to urge the government to ramp up its testing, to consider screening using the antibody test so that we can have a clear indication where we stand as a country as far as COVID is concerned.
Another key concern is the lack of sufficient PPEs for medical workers across the country. The association also wants the reopening of health training institutions to support the health system. With the projected reopening of education facilities, the association says it is in support of the move to reopen. But there is need to have an epidemiology pattern of the virus, as this will also ensure proper measures have been put in place in case of a spike in infections.
We agree with him, we should open the schools, but we should do it in a phased manner.
With the euphoria of easing COVID-19 measures by President Uhuru Kenyatta on Tuesday, there is the real danger of increased infections that the Medical Association urges Kenyans to be alive to.
Already there is doubt in the public in terms of whether COVID is real or it was something where people are supposed to make money. And by politicians going out and Ministry of Health not enforcing the guidelines, then it sends a very wrong message.
Helen Aura, NTV.